Hi, I'm Russel McKenna with Yada Yada. What do you do when you have a fussy one in the middle of the night and they're pulling on their ears? Is it an ear infection? Is it teething? How do you know? Stick around and we'll talk about it. Well, let's talk about what the most common things are. So the younger the child, the less likely they are to communicate what their symptoms are. So when a little one is pulling on their ears, what could that possibly be? They could be teething. They could have pain in the back of their throat. They could just be soothing and pulling on their ears. The older children, they could have specific ear pain. Oh, my ear hurts. Well, if you look in the back of their mouth and you see red sores or a red throat, maybe it's their throat. If you look and see swollen gums, maybe they've got an abscess. The proximity of the back of the throat to the ear is one reason for getting referred pain towards that part of their body. So still, how do you know if it's an ear infection? Who is the most likely to have an ear infection? So let's start with the first 6 months of life. If a baby is exclusively breastfed, it's very rare for them to have an ear infection. That's one thing that will give them the most protection. So a child who is now 6 months to 24 months old, this is the most common time you'll see an ear infection. And then children over 2, you do still see ear infections, but less common than in that 6 months to 24-month window. Well, you'll probably go into the doctor's office often if you are taking your children in just for pulling on their ears. So here's a little trick. If they've had a cold and they have ear pain, is it just the first few days of an illness that they have ear pain, or is it a week or so into the illness? You'll probably have a better chance of them having an ear infection if it's the latter part of the illness, not the first part. The first part, you have ear pain because maybe you have a cold that makes you have a sore throat, and so the throat hurts. Maybe you have congestion, and that makes you have pressure changes in the middle part of your ear, and that would draw attention to the ear. So as you seek to help and console your little one in their time of need, think about these few things, and maybe it'll save you the headache of going into your doctor's office and being told they're just teething, or that they have a sore throat and that it's not an ear infection. Ear infections are usually the consequence of a cold. So good luck trying to do the right thing for your children, and best wishes. Thanks for listening. If you like it, subscribe. Give us a thumbs up. Thank you.